Dr. Audrey Freshman, and I'd like to welcome some of you back from last week. And I appreciate for those of you who are returning, as well as those who are joining us for the first time tonight, welcome. Next week, actually, last week we had Dr. Stephen Dewey, and he spoke to us about the impact of vaping on the brain. And today we're going to have Dr. Saleh talk to us about, Saleh actually talk to us about vaping and the lungs. So before I begin, let me just introduce you to the New York Center for Living. Right now we are the virtual New York Center for Living, but for those of you who are not familiar with us, we are an outpatient nonprofit treatment program located in the heart of New York City. And we've carried that heart of New York City with us now in our diaspora to the universe. And actually, the good news is that we do get to share with you then wherever you happen to be sitting. And so that has been, of course, a benefit. But we do look forward to the days where we can return to our New York City heart. We really cater to young adults and adolescent program. We're unique in that we cater to exclusively that population. And for the most part, that population presents with a mix of substance abuse problems alongside of the mental health problems that occur with it or precede it. And those usually affect kids and young adults in the areas of development, most notably in their interpersonal relationships, their familial relationships, their school relationships, and their own personal growth and development goals. So what do we do about that? Well, what we do is we have a multidisciplinary team approach, and we offer an intensive level of outpatient programming up to about 20 hours a week that you still can access online, or we have an outpatient program that is more minimal. And what we do best, I think, is that we take a case that somebody calls up. It's usually a parent or another treatment facility, and they say, we have somebody who's presenting with some mix of substance use issues, perhaps some mental health issues. We don't know what to do and what should we do. And so from that point on, we do a comprehensive assessment to figure out what is the appropriate level of care. And if they can stay with us, God bless. And if they can, we find the best possible referrals for them. We use an Erik Erikson model of treatments. So we use a developmental model, and we mix that up with evidence-based practices, or the DBTs, CBTs, trauma treatment. And we infuse that, I'm telling you the recipe, with a mixture of tincture of recovery, and in that way, and then we watch it bake, and we try to really help somebody, the goal of which is not just to help somebody get into recovery, because basically our adolescents and young adults aren't returning to a former state of where they were. They're really moving to evolve to a newer state of finding themselves, and we're along to try to help them to really self-actualize. So before I go a little further, I want to introduce you to Dr. Saleh and John McAteer, as well as Araceli, who I think popped off. Araceli is the person who's been organizing all of this program. John McAteer is also there comes Araceli, and John McAteer is our coordinator of our young adult program. And he also is the director of our vaping cessation program. And Dr. Saleh, I will present in a minute. So before I go forward a little bit, I want to talk to you about the issue of vaping. And I was telling you that we are very good at assessment. And so every Monday I run a group basically that's called What Do I Do Now for Parents. And in that group of the What Do I Do Next for Parents, what we started to see prior to the vaping, the COVID days actually, is that there was an influx of cases of people who were vaping, and families that were just completely befuddled about what to do about that. And our adolescents and young adults themselves were saying that they wanted to try to quit using and weren't able to. And so I started to try to really bring attention to this issue, because it really was deemed an epidemic prior to this pandemic, of course, but it was an epidemic and is an epidemic, and 5,700 new cases of kids are being exposed to vaping every day in this country. And so I think that that's really significant, because what we're doing is we're recreating addiction in adolescents, in particular in the group of people that we thought we eradicated nicotine addiction. And to that point, then, I want to show you that the other day here in the Long Island business section, which is only this week, I want to show you that the topic is tobacco. Vaping industry crafts virus sales strategy, to show you how insidious this problem is. So from the headlines I'm going to read. Running low on surgical masks during the pandemic, you can get 2 for free by ordering a battery-operated vaping pen from the company's online shop. Another sleek advertisement reads, COVID-19 relief effort. It blasts the ads of offering 2-for-1 e-liquid vials. Buyers at another shop get 19% off nicotine e-juices if they enter the code COVID-19. As the global pandemic strains the world's inventory of medical supplies, the tobacco and vaping industries are taking advantage of a unique opportunity, offering freebie protective gear, doorstep deliveries, and festive pandemic-themed discounts. The tobacco companies insist they are simply doing their part to help during the crisis. It's as if they don't realize they're in the business of destroying lungs, says Matthew Myers, president of Tobacco Free Kids. It really takes the breath away. It makes you feel what hypocrisy is. In one doorstep delivery promotion, a woman beams as she opens her vaping package, her fists raised in the air. In another, hand-in-hand, models ask customers to help build a community with a shared future for humanity. The tobacco industry has used the moment to enhance its public image. Altria, the maker of Marlboro cigarettes, announced a $1 million relief investment to help support vulnerable residents surrounding its headquarters in Virginia and in other regions where manufacturing takes place. And I'll end with this quote from Altria, the maker of Juul, by the way. Caring for each other and doing what's right is core to our community. And with that in mind, it is for that reason, and that reason alone, that we have to do whatever we can to fight back on this scourge that is affecting our lives, our health, and our lungs. And so we are really looking forward to launching a 10-week smoking vaping cessation program. And next week, Dr. Dewey will be back, and he's going to be presenting again in the kid-friendly version of what he presented last week. So any of you out there who knows anybody from the age of 16 to 30 who could benefit from hearing his presentation again, I will be sending the link. And without further ado, I want to turn to Dr. Saleh. Dr. Saleh is an active member of the medical staff at New York Presbyterian Brooklyn Methodist Hospital since 1990. He's the program director of the hospital's Pulmonary Critical Care Fellowship Program. He's a former president of the medical staff and was a member of the hospital's board of trustees. He lectures nationally and internationally on pulmonary topics and has been bestowed the rare honor of Distinguished Chest Educator by the American College of Physicians for the past 3 years. Dr. Saleh is going to speak to us today as a discussion, and then we will be followed for about 40 minutes, and then we'll have about 20 minutes of question and answers. So post your questions down on the bottom, and John and I will be back to help field them to Dr. Saleh. And enjoy. And now I'm mute.
Good evening, everybody. And Audrey, thank you so much. I wish my wife and children heard that introduction. I don't know how accurate that is, but thank you. I am really honored to be speaking to you tonight about vaping and the effects of vaping and the lung. And we're going to learn a lot tonight about that. Some you may know, some you may not. I would be remiss if I didn't at least briefly discuss the pandemic, the COVID pandemic. This is not a COVID lecture. We are not only discussing COVID, we're going to just briefly mention it. And the reason we're going to mention it is that COVID, the primary organ it affects, while it affects many organs, it can affect the kidneys, the brain, it can affect every organ system. Far and away, the predominant involvement with COVID is the lungs. And we have seen in our hospital, in multiple hospitals, both in New York City, in America, in the world, in Europe, in Asia, we have seen a veritable plethora of pulmonary manifestations of COVID. Now, how does that relate to vaping? Well, it actually relates really directly to vaping because of the thousands of people. As of today, about 4 million people worldwide have been diagnosed with COVID, and a good number of them have had pneumonia, that is, in the lungs. Well, the people who COVID affects the most is when you have underlying lung conditions. So those lung conditions can be caused by cigarette smoking, by vaping, by marijuana smoking. All of these can make your lungs more vulnerable to a potentially catastrophic case of COVID. So I think everyone should know that this still is a very germane topic, vaping, because although COVID has superseded everything in medicine, right? We are 100% focused clinically on COVID. I will tell you that anything that goes in your lungs could make you A, more susceptible to COVID, and even worse, B, you may have a catastrophic complication. And I hate to say this, but people die of COVID, and they die of COVID pneumonia. And so it really is important to know that your lung health is so important. And I would say, as I start to talk about vaping, the only thing that should be inhaled, the only thing that we as humans should inhale is air. We should not inhale marijuana. We should not inhale cigarette smoke. We should not inhale vaping. We should inhale nothing but ambient air that we live in. So with that sort of as a background, let's be much more specific and talk about vaping and vaping in the lung. Now, it is clinically and physiologically impossible to talk about vaping without talking about cigarette smoke. Let's face it, cigarette smoke is why vaping came into prominence. So people have been vaping for a while, but it really became much more of a phenomenon anywhere from 10 to 12 years ago. That's when this current vaping issue really started in earnest. Now, these companies are very smart. Their PR people are brilliant. The way that vaping was presented to the public was very slick. They said, cigarette smoke is bad. There is a universal consensus that cigarette smoke is bad for you. And for those of you, and you guys, many of you professionals know much more about me than about addiction, much more than I do. People who have addictive behaviors, gambling, drinking, cigarettes, etc., many times they are desperate to quote unquote get better. They are desperate to lose that addictive behavior. So the vaping companies with absolute brilliant PR work said, okay, We got millions, literally millions of people who want to stop smoking. This is a more attractive alternative to smoking. Now, we know long-term smoking causes a veritable array of illnesses. As a pulmonary specialist, I'll tell you the big ones: pulmonary, emphysema, chronic bronchitis, COPD, asthma. Don't forget lung cancer, which is the commonest killer of all cancers. So smoking cigarettes causes a huge number of pulmonary complications. Now, there's many other things, clinical entities, that cigarette smoking causes. It causes heart disease. It causes stroke. It causes bladder cancer. It can cause just about anything. You go through a medical checkbook and you see a disease, cigarette smoking may well have a role in it. And for the diseases I've mentioned, have a very prominent role in the development of those diseases. So what they did was brilliant, nothing short of brilliant. They said, we have an attractive alternative to smoking. You will not be at risk for lung cancer. You will not be at risk for emphysema. You will not be at risk for stroke. You will not be at risk for heart attack. This is how vaping became popular. And what they did was they preyed upon that desperation of many smokers and tried to make it a much more attractive option, at least from a clinical standpoint, a much more attractive option. Now, before we even knew about vaping-induced lung disease, before that was even an issue, some studies started coming out, fortunately, that said, hey, wait a minute. This is not like eating M&Ms or Skittles. Vaping can cause terrible nicotine addiction. Now, we'll go over a little later what goes into the vaping product, because that is really important. But I will tell you that initially we didn't have much lung disease that occurred from vaping. What we had was different. And we had some studies that came out and said, oh, slow down, all you vapors, all you vaping enthusiasts. Vaping has lots of nicotine in it. Actually, one pen has an extraordinarily higher amount of nicotine than a pack of cigarettes. So there's a lot of nicotine in vaping products. So we started seeing that, hold on, maybe this isn't so benign. Maybe vaping isn't this panacea for those who wish to stop smoking. Now, that data was starting to come out, but we didn't have anything that said you could die of vaping. You can have really sick lungs of vaping. We did not have that data. Now, there were sporadic and scattered cases of people getting sick, but we were unable, really clinically unable, to make a definitive diagnosis that it was vaping affecting the lung. So, fast forward, the vaping's been around now for a little more than 10 years, and what they were doing, and Audrey beautifully touched upon this in her initial comments, was that they were not only offering vaping with nicotine, they were targeting innocent, young, high school, some even grammar school children by flavoring the vaping. They were having cotton candy flavored vapes. They were having watermelon flavored vapes. I have a 10-year-old, and trust me, if you want to get a young child interested, tell them something tastes good or put a little bonus to it, And so again, their PR work was brilliant. And as Audrey stated, this became an epidemic, but an epidemic that was affecting the most vulnerable population very young. And by very young, I'm talking middle school and high school children. So with that in mind, we still did not have a lot of clinical evidence that it affected the lung. But what we did have was evidence that nicotine is a problem. What we did have was evidence that young children were doing this on a really rampant basis, but we didn't have anything to tell the children, their parents. We had nothing to say, you have to stop. That changed in July of 2019. So in July of 2019, Wisconsin, the state of Wisconsin and the state of Illinois had about 53 cases of what is now called EVALI, E-V-A-L-I, and that stands for e-cigarette vaping associated lung injury. Now, this was not someone who had a cough. This was not someone who was a little bit sick. We had young, healthy people dying. So as of today, there have been about 3,000 cases of EVALI, which again is e-cigarette vaping associated lung injury in the United States. That's just the US, not the world. There have been about 80 deaths of young, healthy people who died because they vaped. And of the 3,000 cases, a very high percentage were critically ill and ended up in intensive care units. Now, all our intensive care units are COVID patients. 6 months ago, every couple of days, we were getting a vaping-associated lung injury. And these people needed high concentrations of oxygen. Many of them ended up on a ventilator. A good proportion of them were sick for a long time. And there were deaths, which is absolutely criminal and catastrophic. So that started gaining momentum. And the studies from Wisconsin and Illinois were very eloquently reported, and it was clear, crystal clear, that vaping was the sole cause. Such that, and I don't want to bore you with too much clinical medicine, they came up with a system to diagnose this entity. So you had to be short of breath, you had to have no other cause, so you couldn't have bacterial pneumonia. I guess to extrapolate to today, you couldn't have COVID pneumonia. You had to have a lack of anything else causing this syndrome. And that syndrome, again, is called EVALI. So we've had about 3,000 cases in the US. We've had about 80 deaths, and these people have gotten really, really sick. Now, the initial studies came out of Wisconsin and Illinois. Every month, September, October, November, clusters of cases were coming around. And again, while this is 3 months ago, 4 months ago, with the unparalleled degree of publicity that the coronavirus or COVID has received, it is absolutely seems like 10 million years ago. But it is really recent that we started seeing vaping-associated lung injury. So it was seen in every state, and the characteristics were the same. And I want to go over some of those characteristics, and then we'll talk about what the risks were to develop this vaping-associated lung injury. So the people were young, healthy patients who got really sick and, as I said, ended up on a ventilator. And There's one case that was highly publicized. I'm sure a majority of you have read about this case, where a young 18-year-old boy damaged his lungs so much that he required a double lung transplant. He was blessed that he was able to get that double lung transplant, but that again just shows the severity of illness caused by vaping. So when this came out, now we purists had a victory. It wasn't a victory for the patients, but as we move forward and discuss the travesty of vaping, the almost innumerable complications associated with vaping, now we had our epic data to say, hold on, cigarettes are bad, vaping is just as bad. And now let me stress a point even more. No one is more against cigarette smoke than me. Probably no one on this planet. And I will tell you this, almost all cases of cigarette smoking lung disease occur after years and years and years of smoking. Did not occur after a couple of cigarettes. What made the vaping lung injury so devastating, so worrisome, was that these people could just vape a couple of times and get catastrophically ill, get an illness that really, in many ways, was life-threatening. So I think in terms of our armamentarium, as how do we go about telling people, don't vape. It's just as bad, if not worse, than cigarettes. We have armed now, and we have eloquent data that shows us if you vape, you run the risk of getting sick, and you run the risk of getting sick theoretically if you vape one time. It's not like cigarette smoking where it's a cumulative effect. It is truly what we call an idiosyncratic event, which means you could do it once or a couple of times and get sick. So I think this has given us much more power to go to vaping companies, which of course won't listen, but to go to parents and to children and say, this is no good. And my daughter attends a school here in Park Slope, and I spoke probably in February, right before COVID started, to the middle school and to the upper school about vaping. And I think one of the issues that really struck a nerve with them was telling them how quick this could happen. This could happen really in an instant's notice. So, no vaping is good. No vaping is good. But if you want to play the devil's advocate, or if you want a little more data, let's give you a little more data. Of all of these cases who developed EVALI, and I'm talking the sick ones who got really sick, there are forms of vaping-induced lung injury where the patients aren't as sick. They may just have some diarrhea, some cough. I'm talking the really severe, the 3,000 cases that were hospitalized, etc. We have found the following, that nicotine alone, while it could cause it, there was a reasonable percentage of people who had just nicotine in a vaping product that got this entity. It is exceedingly more common for this lung injury to occur when THC is involved, which is the active ingredient in marijuana or cannabis, tetrahydrocannabis. So THC products are much more likely to cause vaping-induced lung injury than nicotine alone. Now, listen carefully, that doesn't mean you're fine to vape nicotine products alone. Not at all. There's clear data that nicotine alone is bad too, but you run a much higher risk if you are vaping this so-called THC products, which we have found clearly and unequivocally are more risky for the lungs. Let's take it a step further. Beautiful studies were performed with the Wisconsin data, with the Illinois data, with New York, nationally, internationally, and we have found further through doing bronchoscopies on these patients where we go in their bronchial tubes and get a sample of their lung. We have found through other studies that not only is THC seen in about 85% of these patients, but there is an agent which is done to help mix the THC called the vitamin E acetate. And in one study, of these people who had the vaping-associated lung injury, 93%, when we went in and recovered fluid or lung tissue, had the vitamin E acetate isolated from their lungs. Now, what does that mean to us? You're a parent, you have kids. What do you tell your kids? Number one, don't ever put anything in your mouth. Don't ever breathe anything other than air. That's the take-home message. Number two, cigarettes are bad because you can die of cigarettes. Number three, and most relevant to this discussion this evening, vaping is not the innocent bystander that everyone thought it was. Vaping causes severe, fatal, catastrophic lung disease. One vape, one pen can cause it. Now, you shouldn't buy any vaping products. I want to make that unequivocally clear. But the most risky vaping products are the ones that you don't buy in a smoke shop or in a store. The most risky ones are ones you buy on the street because you don't know what's in those. Not that the vaping companies have these wonderful scruples. Trust me, they don't. But if you go in a store, at least that is FDA mandated, that they tell you what's in it. You buy these vapes from the street, those are the ones that may have some of the impurities that when they're put together that cause this really, really essentially catastrophic lung disease. So when we talk about what happens to these patients, I want to present a case to you just to give you some background. So this was in January of 2020, and I was the doctor in the ICU seeing all the ICU patients. We had a 20-year-old girl, no family history of lung issues, nothing, who came in short of breath, very short of breath, X-ray extremely abnormal. We took a good history. She wasn't a cigarette smoker. She wasn't smoking marijuana, but she admitted readily, because now the issue was really clinically very important. She admitted to vaping. This is a young, healthy girl. She's young and has her whole life ahead of her. So we tried to manage her without putting her on a respirator. We gave her oxygen. We gave her steroids, which in some cases are effective. And that didn't work. She didn't respond. So then we had to put a breathing tube in her mouth and put her on a ventilator. Now, you've all heard Governor Cuomo and all of our leaders here talk about ventilators. Being on a ventilator implies you are critically ill. So she went on a ventilator. Even the ventilator did not work. We could not get adequate oxygen for her. We couldn't ventilate her because her lungs were so sick. So we ended up having to put her on ECMO. What ECMO is extracorporeal membrane oxygenation. Basically, it's a bypass machine where these two large cannulas go into the chest. They take out the unoxygenated blood. It goes in a machine. We oxygenate it and give it back to the patient. This is an exceedingly high-tech, that many hospitals, high-tech procedure. Many hospitals don't have it. Fortunately, in my hospital, New York Presbyterian Brooklyn Methodist Hospital here in Park Slope, we have that technology. There is no more invasive way to manage someone than ECMO. Fortunately, she went on ECMO, her lungs rested, they healed, and about 12 days after her initial presentation, she was discharged home. But imagine the torment that she, although she was sedated, she was the least tormented one. Imagine the torment her family went through. Her parents were there. Her boyfriend was there every day, not knowing quite literally if she was going to live or die. That's how tenuous her situation is. That's how marginal she was. The very next day, we had an 18-year-old boy who, very similar, almost exact same history. The first patient had been vaping for 2 months. This guy started vaping 10 days ago. Another serious illness, ended up on a ventilator, was extremely marginal for quite some time. Again, did get better. They're the fortunate ones. Unfortunately, 80 people in this country did not get better and expired from this entity. So I think the take-home messages are multiple. The first one, and probably the most important one, is vaping is absolutely not a safe alternative to cigarette smoking. Vaping can have the serious side effects, and what makes it, to me, as a clinician, much more frightening is that the vaping associated complications can occur immediately. Smoking usually occurs after years of doing it. Vaping can occur immediately. Number two, vaping, even if it doesn't cause a catastrophic acute illness, we're starting to get, it's small, but we're starting to get some longitudinal data that is showing vaping can cause some long-term lung injury. And again, almost as a perfect segue into COVID-19, remember, COVID-19 can affect anybody, but the people who are dying of COVID-19 are people who have lung disease. So vaping can indeed cause lung disease. So we want everyone to know vaping is dangerous. It's dangerous both acutely, that is short term, and we're starting to get some early data showing that it may be dangerous long term as well. It is not a safe and attractive option to cigarette smoking. And I could end with no simpler comment that the only thing we should be inhaling is air. So I'm going to stop now. It's right around 7:40. That gives us about 20 minutes or so for questions. I see there's some questions coming up. So we'll open it up to questions, and I'll be glad to stay as long as need be to answer as many questions as we can. Thanks for listening to me drone on a bit.
First of all, thank you so much. That was really, to nowadays do a presentation sans PowerPoint is almost miraculous in and of itself. We've gotten so used to the visuals, and so to really be able to captivate us and keep our attention was fabulous. And to drive home the messages that we really want to drive home was really helpful to, I think, all of us, because, you know, yes, we are consumed with the COVID, and in some ways we're powerless over what we can do, other than, yes, we can social distance and wear our masks and do that, but we can also really understand and appreciate that what we have to do is also stop the vaping epidemic in its tracks as well, because to induct a whole new generation, I can speak to the fact of, to create a whole new generation of nicotine addiction is to prime the brain for future drug addiction anyway. Okay, so all we're doing is creating addiction. When we spend gazillions of dollars trying to combat addiction, we create addiction. And with that, I'm going to turn it over to John, who's going to also help moderate some of the questions. So go ahead, you can pick some and help out.
Yeah, absolutely. So I would like to start with some low-hanging fruit. And by the way, thank you so much, Dr. Saleh. I appreciate it tremendously. I really, really enjoyed that you spoke not only of the impact that vaping has on the youth that are using it, but also the methods by which they're obtaining them, and sort of how detrimental they are when not sort of monitored, with the whole vitamin E acetate and that and those additives. So low hanging fruit, right? What is Juul, and does that have anything to do with vaping?
Great. So Juul is one of the companies, and Audrey mentioned them right before we started. Juul is probably the biggest company that makes the vaping products. They're not the only one, far and away the most well-known, far and away the most financially able to put out their product. So it's just one of many vaping companies.
Mm-hmm. Okay, got it. Very good. So there's a lot of questions actually in regards to the role of secondhand smoke of hookah vapes and e-cigarettes, in regards to exposure, how long does it stay in the atmosphere and create harm to other people around them?
Great, boy, that's a great question. There's no data, but I'll give you some anecdotal information. Secondhand vaping, we really don't know much about. Now, if you extrapolate the secondhand smoking data, clearly it causes inner ear infections in kids. It can cause sinusitis in kids. So my suspicion is, if we're having this Zoom webinar 10 years from now, we'll find that there is some secondary issues. Now, having said that, I would be very reluctant to be around anyone who vapes. Now, I heard you mention hookah, and I should have mentioned that. Hookah causes lung disease too. There's a beautiful study that came out about 3 years ago that showed people who do hookah, and there's hookah bars all over our city, right? They can get obstructive lung disease, which is sort of an asthma-like or even an emphysema-like condition. So hookah is bad directly. Indirectly, I would say, while I can't give a definitive answer, I sure as heck wouldn't be around anyone who's doing a lot of hookah or who's doing a lot of vaping.
Mm. Great, thank you so much. And there's a lot of interest in regards to sort of, is the damage that the lungs take in regards to vaping behavior, is that reversible over a span of time once folks cessate from use?
So good question. Again, people have been smoking cigarettes hundreds of years. We know that once you get COPD, that's irreversible. In terms of vaping, usually the initial cases that I reported from Wisconsin and Illinois, dying is not reversible, right? So if they die, that's not reversible. Now, in terms of developing long-term emphysema, COPD, while there is no data, simply because it hasn't been around as long as cigarettes, a few studies have come out that showing these people are getting chronic asthma. Mm-hmm. So again, although I can't say it's irreversible, I would say, does the potential for irreversibility exist? Absolutely.
Oh, wow. That's very helpful. Very helpful. There's a question here in regards to, can you talk about the ingredients of the propylene glycol and vegetable glycerin, and any studies in regards to the safe use of those?
Good question. No real studies on that. The only studies really have shown THC and the vitamin E acetate as direct pathogens from the lung. The acetate products, we could get a study in a week or 4 or 6 that does indeed show they're pathologic.
Mm-hmm. And did you happen to mention like a percentage of COVID cases that are related specifically to vaping?
So again, we don't have that data, but we do have data that about 65 to 80% of people who get COVID really sick on a ventilator, etc., have some underlying lung condition.
Mm-hmm.
How much of that could be vaping related? Listen, we've had a lot of young people develop COVID, people who you wouldn't think would die of COVID. We've had young people die, and unfortunately, John, they get so sick so fast, we haven't been able to ask, you know, are you vaping?
Mm-hmm. Mm-hmm.
You know, let's always try to have common sense. Why do anything to hurt your lung when the organism that's literally once in a lifetime is rampaging through our world? Why take a chance?
Right. Very good. Very, very good. Would smoking, I think you probably answered this question already, but would smoking CBD without the THC be as harmful, since it's still inhaling something, right? So
potentially as harmful, yes.
Yeah, okay. And is there any, so there's one here that I really, really liked. I mean, I like them all, don't get me wrong. Okay, here, what are some protective factors or prophylactic measures that can be taken to reduce the risk of vaping or smoking to avoid it altogether?
Okay, good question. I'm going to give the cryptic answer, then I'll give so the real answer, don't vape, okay? Now, having said that, right, which may not be so easy, if indeed you are going to vape, which you shouldn't, if you're going to smoke, which you shouldn't, good lung health helps. So exercise, walk a lot, don't be a couch potato, exercise your lungs, make your lungs work. That potentially can, quote unquote, prophylax you from the ills related with vaping.
That's awesome. Are there certain populations or communities where vaping is more prolific in? Either affluent, African American, Caucasian, Asian?
Great question. The short answer, everybody does it. Yeah. Everybody does, which again is bad, right? That's one of the reasons the numbers are so high, because people have access to it.
That's right. And there's a question here that asks essentially, are traditional smoking cessation programs helpful in regards to treating vape? And
Absolutely.
Yeah,
absolutely. That's a great question. So, that's funny. I'll extrapolate the smoking. So, as physicians, and I'm a pulmonary critical care specialist, so all the more reason smoking is ingrained in my brain constantly. There is not one visit a patient makes to me that I don't tell them to stop smoking. Now,
right.
There was a study done in a big chest journal that said it takes about 6 visits, the average if someone's going to stop 6 visits. So someone comes to you and they're smoking or vaping, and you ask them to stop, and they don't stop the first time, don't let them off the hook the next time. And about 6 visits is average. Now, I will tell you that in my practice, I've had a good number of patients who have told me, hey, doc, I'm not smoking anymore just to get you off my damn back. And I can't tell you the unmitigated joy that brought me, because I know that being a pain in the neck like that is well worth it.
Yeah, absolutely, absolutely. And also, I will also take this opportunity to kind of plug the program that we've developed in regards to the in association with the American Lung Association. Is a 10 to 12 week basically course or group where participants are going to learn basically how to cessate from vaping use. We're going to be launching.
Excuse me, that's an invaluable tool, John, because I imagine this is geared at younger people, and this is where you got to start. So I encourage you to do that, and I really think you can have a great impact with a program, a huge impact.
Yeah, I mean, it's almost, given that we are a treatment agency for adolescents and young adults, it seems as though it's almost synonymous that if they're coming in with some other drug use, that vaping is also a part of that.
A big part of it, yes.
Yeah, exactly. How has vaping, how has vaping as a mechanism increased marijuana addiction?
Wow, good question. So I think that before, right, when you wanted marijuana, you had to get the plant, you had to get the paper and roll it. Not that I rolled much marijuana, to mind you, but this is what you had to do. Now you can just get a vape, much simpler, right? You get it, you inhale it, there you go. So it clearly has made it much more available, right? And again, that's probably not a very good thing.
Yeah. I will say, just sort of anecdotally, we had two of our adolescents relapse at the same time, one to flower combustible marijuana and the other to vape cartridge with THC oil. The levels of the adolescent that vaped the THC oils were double the THC content of the combustible flower marijuana.
Great point. And I mentioned in the lecture, even if there's no THC, the nicotine levels are astronomical. Mm-hmm. So again, this is all ways that we should promote vaping is bad.
Yeah, absolutely. So there's
I'm popping in on this.
Please.
Just to say a couple of words, and hello to everybody again. One of the things that I think also is important for families is that it's not only about the kid coming involved, but it's also about the family taking the stance, because very often it is the parents who is the one who understands that there's a problem, and they say, what can I do about it? And maybe the kid wants to go and doesn't want to go. Maybe they want to stop using drugs. Maybe they don't. But it's really for the parent to say, I'm the one who's going to insist on that you go to attend a program and learn about it. And, and even coming to something like what you're presenting today, where you present the moment in time where you could be vaping once and you could die, maybe that would be something that would resonate. And the other point I wanted to say about the association between marijuana or the use of drugs is that back in the day, or when you smoked a cigarette, you at least knew when you came to the end of it, just like with a joint, when you come to the end of it. But with what's happening with the vaping is that there's no concept at all about the intake or that I reach the end. And so it just keeps going and going. So with that, I wanted to throw that idea.
That's such a very relevant point. Thank you for bringing that up, Audrey.
Yeah. And one of the things that I've learned in some of the websites and sort of resources that I've come across is that, like Dr. Saleh said, that they're less harmful than cigarettes, but less harm doesn't mean harmless, right? And so, and to really kind of drive that home, because I feel as though it's been minimized. There's been so much minimalization of use because it's not as bad as whatever. Right, but I think we're learning very quickly that it is
actually really trivialized. It's been trivialized because, it's not as bad as smoking. Well, I think after what we discussed tonight, you can see it's every bit as bad.
Yeah, because everyone said, "Oh, it's vape, it's vapor." It's like, no, this is not water vapor. This is aerosol. It's actually carrying metals and a whole bunch of other bad stuff. Yeah, yeah. So let's see. We have plenty of questions, so don't you worry. Are there any websites or materials that give facts and overviews of dangers of vaping that they can use with adolescents in their practice?
So there are a couple of ones, I'm sure. I mean, you guys are affiliated with the American Lung Association. They're a great resource. I'm a member of the American College of Chest Physicians, ACCP. You can find a lot on vaping there. The ATS, or American Thoracic Society, which I'm also involved with. So these are prominent organizations that you can get a lot of information off their websites.
Wonderful, wonderful. Truth.org is also another one that we've used. And also, in our vaping program, we're going to actually put participants in touch with like a daily texting service that kind of checks in with them. And that's there's a whole bunch of resources that we're going to be able to use. So one question that keeps coming up over and over again is the substances in hookah different from what is in vaping?
They are a little different. And again, a lot depends on how you mix them, right? So again, these things that are nebulized or aerosolized, so to speak, you can put whatever you want in them. I think clearly that usually, unless you're in an illegal place, there's not THC in hookah, but there can be plenty of compounds that are deleterious to your lungs in hookah. So the short answer is different, but the more detailed answer is the devil is in the detail, and it depends on what goes in there.
Right, very good. What would you say is the best way to kind of taper off of vaping? Cold turkey? Like, what do you decrease nicotine amounts? Like, what do you think?
So to me, it's the same as cigarette smoke. The way, I get people coming to me, and so many people think that there's pills, there's something called Chantix, that they think you're going to take the pill and cataclysmically want to stop smoking. That is so unrealistic. So my feeling, again, this is just as a clinician, the best way to stop is to cold turkey, right? Your brain has to want to stop. And if you take a pill or a nicotine patch, that's not going to make you want to smoke. And I generally discourage those products because if you take nicotine via a patch or gum and smoke, you can get overdose. You can get a nicotine overdose. So I try to individualize each case. I have put some people on the pill. I have put some people on the nicotine patch. But my gut feeling is the best way is just to stop.
Okay. Very good. Very good. So where are we at, Audrey?
Well, I guess we're coming to the end. And actually, just so you know, Dr. Saleh, that on my cell, which is the off-screen version, it's I like him, he's great, we want him back. So that is the...
Sure they're not doing THC too much?
No. No.
Yeah, I meant to mention that. I mean, how much stroking did you want during the Q&A? There's a lot of good feedback.
No, but that's the truth. Thank you. It's been wonderful. And for all of you out there in the universe, we are going to be offering orientation next week to our smoking cessation program. We really want to encourage people to come out and it's going to be, again, we're going to offer it for free next week. So bring your kids. Dr. Dewey's going to kick it off again with the kid-friendly version. Last week he did the whole very complex brain version. Now he's going to do, but he speaks to 13-year-olds. So he's going to do the more kid-friendly version. And I'm going to encourage everybody to come and really try to say, what am I going to do while I'm in quarantine? What could I do different in my life? Maybe I could give up smoking. Maybe I could free myself while I'm entrapped in the universe. Maybe that would be a paradoxical gift we can all give to ourselves for health. So with that in mind, I want to wish everybody truly
Remind them about the slide, Audrey. Remind them about the last slide, the survey.
Yes. Thank you. You see, that's why it takes a village. So the reality is, for those of you who are looking for CEs, stay on, because Araceli is going to present a slide, and it's going to be a survey, and you need to fill out the survey in order to get your CE. And with that, Araceli, are you around? You can post it, or we have to disconnect. There she is.
And also embedded in the survey is also questions and preliminary information if you're interested in joining our Nip It in the Bud program. So, you know, as you express interest, it'll take you through what's your name, who are you referring, and then we will contact you from there.
And I want to say that through the generosity of the board, though there is a minimal fee for it, the board has really come through in helping us to finance it. So we're trying to make it, money should not be the thing that stops you from coming to the program. Let's put it that way. And with that, Dr. Saleh, I want to again thank you, and thank you to Araceli and to John.
Let me thank all of you. This was wonderful. And I must say, I am so impressed by your organization. You should be very proud of the work you're doing, and I look forward to working with you further. Thanks so much.
Thank you.
Thank you, Dr. Saleh.
Okay, thank you. And Araceli, take us away.
Yeah, quick, put it up, Araceli, quick.
So once this webinar is over, a box is going to be prompted to take you to the link for the evaluation. So that's how it's going to work.
Awesome. Thank you, Araceli. Thank you, everybody.
Thanks, guys.